Alright, so today we're going to do Charrette's protocol for the lower extremities. And the three indicators for a pronation protocol is a positive navicular drop test, a grade 4 less muscle test, and a combination of abduction and eversion. So for the muscle test, we're going to start off with glute medius that goes with the cuboid and resist. Goes weak, and we'll start off in navicular, cuboid, cuneiforms, midheads, talus, and calcaneus, phalanges, and fib head. And for the three indicators for a supination protocol is a negative navicular drop test, high arches, or a combination of inversion and adduction. So we'll start off with we got to do the muscle test for that also. I would do a different one on this one. We'll do a psoas that's connected with the navicular and resist. That goes weak. So then we'll start off with navicular and cuneiforms at the same time. And cuboid, tarsoids, midheads, calcaneus, talus, then calcaneus, phalanges, and fib head. Next we'll assess the knee. Extension. And I feel there's a lot of movement in the medial head, so if you have a flip over, Chelsea can flip over. And since on the medial head, we'll have the tissue pull from lateral to medial. Bring your leg past 90 and impulse. And flip back over. And reassess the knee. And that's stable, strong. Next after that, we'll do a talus, alternate talus adjustment. It usually goes anterior, slightly lateral. So you flip over, Chelsea. Make sure the edge of the table is like right on the talus. Bring it to pre-tension and impulse, and back over. Then we'll do the big toe. And for the bunion, just slide off about 3 or 4 times. Next we'll do check the patella. The patella usually moves about 8 different directions. And I feel restriction going from right to left, so bringing in pre-tension and just a small impulse and reassess the patella. And that's good. Next we'll move to anterior femur. I'm going to do a muscle test for that. Rectus femoris and resist. That one weak. So we'll get her in. And looking for where her knee is locked up. Impulse and reassess the anterior femur. Resist. It's grade 5, it's strong. Next we'll do the muscle test for internal, external rotation of the hip. And we'll use the TFL for that. And resist. That goes weak. And we'll rotate the hip internally, checking for external subluxation. And then we'll rotate the leg. Rotate the hip also externally, checking for a internal subluxation. And I felt up here, we got something going on up here, so then we'll impulse from P to A, bringing her in pre-tension. And retest the knee. Recess the hip. And grade 5 is strong. Next, we'll get into the wrist extension technique. So, Chelsea, can you stand for me while I demonstrate this? Got to put on your protection. So, what you'll have is you have your non-dominant hand, which is your pressure hand, and your speed hand is usually your dominant hand. For the knee, you apply 50 to 70 pounds of pressure with your non-dominant hand, and 10 to 15 with your speed hand. And for the anterior femur and for the anterior humerus, you apply 10 to 15 all the way around. So the setup for this: have your knee as a backstop, set up, and hold for about 2 to 3 seconds. All right, so Chelsea, come back on. So we'll test the knee first. And her lateral condyle seems to be out, so you can flip over for me. Once again, put on your protection and find the lateral condyle head. Find it, set up, and flip back over for me. And we'll reassess the knee again. And it's strong and stable now. Next, we'll check for anterior femur. And resist. That went weak, so we find the femur head, come over, out on top. Same thing with the setup. And retest it. It's now grade 5 and it's strong. And I'll move up here to the shoulder, checking for an anterior femur. The muscle test for this. And resist. That went weak. So we're going to set up here, find the deltopectoral line. And Chelsea, if you can look that way for me. Thank you. Actually, can you take that hand and kind of just cover up your... Yeah, there you go. Awesome. There you go. And set up. Good. And we're going to retest. It's now grade 5 is strong, and that is Charrette's protocol.